What's that?
Around this way, excuse me. Right here. This is Miss Sonia.
When Eugene Matthews turned 40, he got something he didn't want and had feared for years.
Have a seat right here so I can get your blood pressure.
Yes, ma'am.
Knowing my family history of diabetes, and as I approached 40, I thought that I had dodged the bullet per se. But right at 40, a few months past my 40th birthday, I had a checkup, went to the doctor, and was diagnosed with diabetes.
It turned out to be a checkup that may have saved his life.
It's a good thing I came in when I did, because I was pushing 400.
And normal blood sugar is anywhere from 80 to 120. On this visit to Elite Care Medical Clinic, Eugene's blood sugar is still above normal at 185. When that happens, the clinic manager alerts the doctor, who orders a hemoglobin A1C test. That is a test that shows your average blood sugar for the past 2 to 3 months, which can reveal how well your diabetes treatment plan is working.
Sometimes you can do everything in your sugar and you don't know what's going on, and it just gets out of whack and you don't know why, and you're just like, man, I've done everything, what's going on? But that play tells you, well, it's nothing for you to do but go back to the doctor and explain it to your doctor.
From patients from 1 to 10, out of the 10 patients we see, we're going to say 8 of them are diabetics that come to the clinic.
We're going to see a lot more patients with kidney failure. We're going to see a lot more patients with hypertension, heart attacks secondary to dyslipidemias that are associated with type 2 diabetes. So the implications are going to be very grave.
Preventing those kinds of complications requires early intervention and patient education. That is the goal here at Elite Care Clinic.
The whole purpose of us being here to teach them how to better understand what that level, that number means when they're doing their daily finger sticks, how to appropriately take their medications, when to take it, how to better eat. We're just not telling them, okay, your blood sugars are uncontrolled. We are educating them how to better eat.
In fact, as early as a first visit to Elite Care, patients can expect to learn much more about what's going on in their bodies than just their blood sugar level.
If the patient report that they are diabetic, that they have some type of dizziness or instability, we perform a balance testing on them. If they are patients over 50, female patients, and they have an indication of osteoporosis, we do bone scans on them. We've just started doing that. We've obtained that piece of equipment to do that on them. We also do what we call eye checks on them with the tonal pen. It tests for the pressure, and it's with those patients that suffers from diabetes, hypertensive, or they have a family history of that. So these are just the basic tests that we do on the patients when they come in here to the clinic. What we try and do is maximize their office visits so that they don't have to come back so frequently. We try and consider ourselves a one-stop medical shop.
How you want me, Frank? Just like that. That's fine. That's fine.
That comprehensive approach helped Eugene become aware of a potential complication.
Try not to move your eyes, your head, or your body. Try to be as still as possible.
All right, I'm gonna try this now. If I fall.
Let me know when you're ready.
Okay.
This is the balance test to check whether diabetes is starting to affect a patient's nervous system. Eugene's result, abnormal.
It's a good thing that they have this at the clinic, because I didn't know they could tell that due to my diabetes, my balance was off and my nervous system, something's wrong with my nervous system. And I'm glad for that, because now I know we can go on and correct it.
Exercise is good for the soul, Eugene. And with you need it because it helps keep everything circulating and moving.
Elite Care Clinic also has a weight management program, combining exercise with healthy eating tips, emphasizing that extra pounds can not only cause but complicate diabetes.
The sooner you intervene, the better off you'll be. In fact, it can be, very much like a chronic disease that you can just control by your diet. And really, you could almost cure it, initially, if you act early on and work to reduce your obesity load.
In the future, we're planning on opening up dental as well as vision, because we've noticed that a lot of our diabetic patients, as their diabetes progress and it goes untreated or not really taken care of, their vision becomes, it deteriorates, their dental hygiene deteriorates. So these are other 2 aspects that we're looking at implementing within the next year to 2 years here at the clinic.
With the comprehensive care he's getting here at Elite Care Clinic and the unwavering support of his wife, Eugene believes he can not only live, but live healthy with diabetes.
It's not really the sugar and all that. It's the starches, the carbohydrates in that. And if you can control that, you got it. You know, your diet, exercise, and so I said, well, hey, I can do that. I've been doing that all my life. So that made me come around and say, well, let's try this. I'm not really one to really give up, so I say, hey, if you want to fight, let's fight.